we have limited resources even in a private setting. And when I say under strain, I'm not only talking about beds for COVID patients, I'm talking about beds for non-COVID patients. Patients who require urgent surgery, whether it be in the form of a malignancy or an orthopedic procedure, those beds are now suddenly not available.
The second wave, the sheer speed at which the numbers increased really put severe pressure on the whole system. You know, with the first wave there was this incremental increase, we could plan, we could move resources around, move people around, but then we saw the second surge where huge numbers of patients started arriving in many different hospitals all at once.
Very difficult discussions to have with families, because everybody wants their family to have the best care. Everybody wants their family to end up in ICU if it's needed. Doesn't matter how much money you have, doesn't matter what option of the medical aid you're on. There just is no capacity.
All have a contribution to make to this as a whole to South Africa, that people should follow good sound data by professionals and epidemiologists and infectious disease specialists and physicians and emergency centers and general practitioners, because these are people who are educated and they deal with this on a daily basis, and they can see the impact that the community has and their behaviors on healthcare right now.
This is a COVID isolation unit. Any patients who've got confirmed COVID will be admitted here, and they will be kept here until they either get sicker, in which case they will then move up to the ICU, and until they get better, in which case they'll go home. We don't know why those people get worse. We've got no idea. We used to say, well, if you had comorbidities, you had a greater chance of getting worse. But I mean, I've had really sick people in their 40s and 50s with no comorbidities, and yet they've just got worse and worse and worse no matter what we do.
I think our plea to the public is really to just adhere to the basic protocols. We're not asking them to do a huge amount of work. Just wash your hands, wear your mask. And it's really about caring about somebody else when you do that. It's not even about protecting yourself, it's about caring about somebody else. So taking up your social responsibility and just caring about somebody else. It's as simple as that.